Today we're going to perform the physical exam competency for your med-surg competency. We have the nurse and the patient here. First we're going to perform hand hygiene, provide privacy. The nurse will introduce herself, identify the patient using 2 identifiers, and explain the procedure to the patient.
Hi, I'm Heather. I'm going to be your nurse today. I'm going to do a physical head-to-toe assessment. Is that okay? Okay. Can you tell me your name? Okay. And I'm looking at the bracelet, looking at your birthday. Thank you.
The nurse will offer the patient a chance to void, and during the assessment we'll watch for signs of abuse. We'll note the facial expression, the presence or absence of distress, observe hygiene of the patient, and grooming. Next, we'll evaluate the level of consciousness and orientation to person, place, and time.
Can you tell me your name again? And where are you at?
Yes, sir.
And what's today's date? Very good. My patient is alert and oriented times 3.
Observing speech for clarity and appropriateness.
Her speech is clear and appropriate.
You will state vital signs will be taken. Next, evaluate the respiratory rate, rhythm, and character. This is part of the inspection phase, so you're just checking to see if your patient is in distress. And then we'll palpate and inspect the skin head to toe for temperature, moisture, skin turgor, edema, and lesions.
I'm just going to feel your skin with the backs of my hands, from head to toe, on both sides. Skin is warm and dry. Skin turgor is elastic. No edema is noted and no lesions are noted as well.
Inspect and palpate the fingernails and toenails for thickness, adhesion to the nail bed, lesions, clubbing, and capillary refill.
Capillary refill is brisk. Nail beds adhere within normal limits and there's no thickness present. No clubbing is noted on the fingers as well.
Examine the upper extremities for strength by checking the patient's hand grasps bilaterally.
Can you squeeze my fingers for me? Thank you. Hand grasps are strong and equal bilaterally.
Palpate and compare radial pulses for strength, regularity, and equality.
Radial pulses are strong and equal bilaterally.
Examine the eyes for pupil shape, size, equality, and response to light. And your light will have a pupil gauge on it for measurement.
Can you look at my nose, please? Pupils are pearl and they are about 3 millimeters bilaterally.
Inspect the ears for any abnormalities. If there was a hearing aid, you would remove that first.
No presence of wax buildup. My patient is not wearing hearing aids, but had she had them in, I would remove them before examining her ears.
Observe the nose for any abnormalities. You'll be noting congestion of 1 or more nares and also making sure that the septum is not deviated.
Okay, nares are clear congestion and no deviated septum.
Examine the mouth, including the lips, tongue, and oral mucosa for any abnormalities. You'll be looking at the presence and condition of teeth or dentures. Be sure to remove the dentures for the exam.
Can you open up your mouth, please? Okay, lips, tongue, and oral mucosa are pink and moist. My patient has her own teeth in good condition. Had she had dentures in, I would ask to remove them before examining the mouth.
You'll have the patient smile and also stick their tongue out, observing for symmetry and making sure that there's no deviation to the tongue.
Can you smile, please? Smile is symmetric. Can you stick out your tongue? Tongue is midline.
Name and locate the brachial and carotid pulses.
This is the carotid pulse. This is the brachial pulse.
Next, you'll auscultate the posterior, anterior, and lateral lung fields, 10 anterior, 10 posterior, and then 4 lateral. You'll be looking for duration, pitch, and intensity. You'll be doing this top to bottom, side to side.
Okay, every time my stethoscope touches your chest, can you please take an inhalation through your mouth? Thank you.
The nurse is making sure that she's listening side to side, comparing each breath sound from one side to the other.
Okay, you can go ahead and make that. Thank you. Lungs are clear bilaterally.
Next, identify, palpate, and auscultate the heart sounds at all 5 anatomical landmarks and note any abnormal sounds. You may reposition the patient if needed.
This is the aortic. Hold on it. Herb's point. Tricuspid. And mitral.
Palpate the PMI, or point of maximal impulse, noting the size and location. If unable to locate it, you can turn the patient to the left side and try again.
Border size indentation, midclavicular to intercostal space. Okay.
Next, you'll check the apical pulse for 1 full minute. You're checking the rate, rhythm, and clarity, and you must be within 2 beats of the instructor. So you will tell the instructor when to start and when to stop, and then you'll compare heartbeats. You'll note any extra sounds or murmurs. Next, place your patient in dorsal recumbent position, if tolerated, for the abdominal exam. You'll inspect the abdomen for any abnormalities. You'll also ask the patient if there is any abdominal pain or tenderness and where it's located. Those areas would always be examined last. It's important to note when you're doing the abdominal exam that you must inspect, auscultate, percuss, and palpate in the correct order, and you must also do that while you're looking at the abdomen of your patient. So you must pull the patient's shirt up.
Can you please bend at the knees? Thank you. I'm gonna pull up my patient's gown and look at her skin. In real life, we would have you, for your competency, show the actual patient's skin. I am inspecting the abdomen. I do not see any masses or distension noted. Are you having any pain? Okay, I would assess the painful area last.
Next, we'll auscultate the bowel sounds in all 4 quadrants. So listening in each quadrant until you hear active bowel sounds. If you would not hear active bowel sounds, you would have to listen 5 full minutes in each quadrant in order to say that they are absent. When listening to the bowel sounds, there's no particular order that you have to go in. You just have to make sure you listen in all 4 quadrants. Next, we're going to use the percussion technique over the abdomen to identify tympany or dullness. Tympany is a hollow sound. Dullness is a thud sound when you're over an organ or possibly stool. Next, we'll lightly palpate the abdomen in all 4 quadrants for tenderness, masses, and distension. And this palpation is using the palm of the hand and working it across the abdomen, making sure that you feel in all 4 quadrants. And then we'll palpate the bladder, noting any distension. You'll palpate the bladder using the palm of the hand.
No distension noted in the bladder.
Now we'll name and locate the femoral and popliteal pulses.
This is the femoral pulse, and this is the popliteal pulse.
Name and locate and palpate the dorsalis pedis pulse and the posterior tibial pulses for strength, regularity, and equality.
This is the posterior tibial pulse. They are strong and equal bilaterally. And the dorsalis pedis pulse. They are both strong and equal bilaterally.
Examine the lower extremity strength by performing dorsiflexion and plantar flexion resistance test. And you'll do this by standing at the end of the bed. First, we'll do the dorsiflexion.
Can you pull your toes towards your nose? Great.
And now plantar flexion.
Can you push down like on the gas pedal? Great, thank you. dorsiflexion and plantar flexion are both strong and equal bilaterally.
At this time, you would record all your findings in the narrative nursing notes or your flow sheet charting. You would state that any abnormal findings would be reported to the physician or the RN in charge, and then perform hand hygiene. This ends the competency for physical exam.